In this video, I'm going to talk about what the options are if a patient desires larger testicles. Now, there's many different reasons folks may choose to go bigger, just really similar to the world of breast implants. We're very used to the concept of breast augmentation, where we keep the natural breast there, obviously, and we slip this guy in underneath the breast or underneath the muscle to project things forward and enhance the appearance of the breast. And testicular enlargement, it's a lot more rarely done, but it's quite a similar concept, and we're seeing more and more folks who are opting to do this. And in this video, we're going to talk about the ins and outs of it and what we do in my practice for testicular enhancement. So first of all, why get it? There are lots of different reasons. Some folks may have quote unquote normal size testicles. I'll show you what the average size is in the United States. It's about 3 by 2 centimeters in general, if I can get my testicles out of their little pouch here. So here we go. So in general, this is about the average size, about 3 by 2. However, there's many different reasons folks may have smaller testicles than this. They could be born with smaller testicles. There's various genetic reasons, such as Klinefelter's is a common one that we see. Injury can be common in one or both sides. Various different viruses, mumps, for example, is notorious for it. And what we do in the case of testicular enhancement is we leave the natural testicle behind, usually, because it's usually doing its job. It's producing testosterone and possibly sperm, so we just want to leave it alone. Now, it was described in the past, I'm not sure if people are still doing it, but to wrap an implant around the native testicle. But in general, I'm not a fan of doing that, because we want to be able to examine our testicles for lumps and bumps, because testicular cancer can happen. So we need to be able to do surveillance of the testicle. So the safer way, in my mind, is to approach it a lot like a breast augmentation. Leave the natural testicle alone and unbothered, and instead put in a larger testicle that will be visible in the scrotum. Typically, the native testicle goes behind and sometimes a little bit superiorly, and the implant sits down in the scrotum where it's more visible in the natural position. So you end up with a situation like this. It is possible to, in certain configurations, see 4 testicles, and that's important for exam because we want to check the native guy. But in general, in the natural position, the implant is going to sit low and look very natural in the scrotum. Size is a very important conversation I have with folks who are getting this procedure done. I like to use these soft, squidgy, high durometer testicles, which are made of silicone. They are a solid carving block, so they can't rupture, unlike a breast implant here, which has a shell and a substance on the inside. And so typically this is the largest one we get off the shelf, but in general folks want to go bigger because we want to make sure to get a natural result that this guy is big enough to obscure the natural testicle. And so for this reason, this is the largest one off the shelf. It's 5 centimeters in its longest diameter, 5 by 4, but we can make them larger than this, and the largest I've seen in my practice is about 7 centimeters. We want to make sure the scrotum can comfortably fit in this testicle. The procedure itself is very straightforward. We do it either under general anesthetic or with deep sedation. I leave that discussion between the patient and the anesthesiologist, and either way the patient is not going to be aware of anything that's going on. We make a small incision low down in the middle of the scrotum where that natural line is. We try to keep it to about 1 inch because usually we can squeeze these guys in through a smaller incision, and we're going to go ahead and make 2 separate little pouches. There is a septum in the scrotum there. We try to keep this intact so that our our testicular implants go into 2 separate pouches, and we pop them in where the native testicles live. We close the fascia in layers over the testicle to protected from the outside world, and then we close the skin with dissolvable sutures. Things that are very common after this, bruising and swelling, is absolutely the norm. And the other thing about this procedure is in the first few weeks, the testicles are going to sit high and the scrotum is going to feel swollen and tight. This is very normal. It varies how soon they drop down into a more natural position. It depends on the elasticity of your skin, the size of the implant, things like that. But with time, gravity wins and these guys sit down where they're supposed to sit, naturally low down in the scrotum, and as long as they're big enough, they're going to obscure the native testicles, which are left behind, minding their own business, continue to function as usual. The worst thing I always say that can happen with this procedure is infection. Thankfully, it's pretty rare. We put it at about 1% or less. If you were to get an infection, usually these implants have to come out for at least a few months to give the area a break, clear the infection, and then the implant can be replaced. But this is becoming more and more common. This procedure takes less than an hour. A big part of it is deciding the right size for the individual. Like I said, we can do off the shelf. This is the largest one, 5 centimeters, or we can order a custom implant. I like my patients to be very involved in that process, as this is their body and it's good to have that involvement there. I hope this helps.